I'm from Charlottesville, Virginia, so I went to UVA as an undergrad, and I first studied astronomy and physics for about 2 semesters and then flipped to pre-med. And then after that, I went down to Grenada for medical school for 2 years on an island, and then 2 years in New Jersey, and then just finished 3 years at the University of Kentucky in residency. So I'm a primary care physician, and as you know, that encompasses a lot of different aspects of medicine right there. What you would expect from us is the coordinator of your general care. So we get to see people that come in off the street, have an acute problem, or come in off the street and have 10 problems and they're on 10 different medications, and sort of have the opportunity to pull it all together and make sense of it. Prevent them from ever having to go into the hospital is our job. For me, it's definitely to get to know them and to understand every single one of their problems and list it out and figure out what records do I need to get and all these technical things. But also I think it's to give a face to what hopefully will be their future coordinator of their care. That's the goal that I think they have in mind, is to see who is this guy and does he care enough to talk about all these things? Does he have time to talk to me about everything, which I do my very best to take the time to talk to patients about all that, gain a good comfort level with them and establish that relationship that hopefully will be long-term. Unfortunately, I feel that a lot of times patients come and they don't have a good understanding of what's going on with them. Even if it's one simple problem, it just hasn't quite been explained to them. I do my best in that situation to sit down, and even if I have to draw pictures, it's one of my favorite parts about the job is to explain to people in language that everyone understands what's going on and why you're on this medicine or why we have to do this test every 6 months and what the point of it all is, and is that okay with you, because it's not a cookie cutter. Everybody's got their own personal goals in mind. But just to explain what the problem is and what things we currently can do in today's medicine to help them and make sure that they understand what's going on, because ultimately once they leave the office, it's on them what they're going to do with their instructions that they have, and if they have a good understanding of what's going on, then we're well on our way to the best possible care. Well, lately it's been a lot of running. I signed myself up for a couple races in the next year. So I've been doing a lot of running and biking, actually straight from the office. If I have a little break, I'll run around Hampstead. But aside from that, I have 3 kids, so there's always something going on with one of them. T-ball, birthday parties, that kind of thing. I think the motivation now is to meet new people and to go see who I can help today. In this job, you don't always get a quick fix, but sometimes you do, and sometimes you get kind of a hunch about a diagnosis, and it's sort of like a puzzle. So every day I get at least one of those things coming in the door, and something to figure out, and some new people to meet. There's a lot of good things that I expect on every work day, really.